once I've gotten the rec I've gotten the rec, I'm gonna come over here to the computer to make sure that everything's set up. And I'm gonna go ahead and off the rec. I'm gonna go over here, look for the name, and make sure it's on the right one. I'm gonna hit exam, make sure it's the right exam off the rec, and then go with the first the list and figure out there. That way, and then from there, I'll go ahead and go get the patient and do ID and everything. And once I've done this, I'm going to go ahead and set up the room for the exam, and then get the patient. This is my chest trigger. I'm going to be doing everything in the room, but normally with the patient ID and everything like that, it'd be as if I'm walking the patient from the waiting area to the changing area or to the room. So I'm going to go ahead and start with patient ID. Good morning. My name is Stefan. I'm with radiology department. This hospital meeting name, your full name?
Stephen Kimura,
And your date of birth?
November 6, 1984.
Alright. And if this was a woman, so we're leaving from the waiting area. We've already left. And if by chance this was a woman, I would be asking if she was pregnant. And at this point, I am going to be doing a knee exam, which is going to be AP, oblique, and lateral. I'm going to go ahead and start. I'm going to have my plate. This is going to be tabletop. There you go. I'm going to go ahead and center half inch below the apex of the knee. Gloves. This is the AP. I'm starting with the AP knee. I'm going to do this 60 at 3 for my technique. Make sure he's covered. And then go ahead and go back, have him hold still. Shoot. Thank you. Take it back, stick it in the reader. Making sure it's under the right name in the exam. Now I'm going to go into the AP oblique knee. Lift up. And make sure that the whole leg is turned oblique internally. Again, it's going to be half inch. I'm going to go ahead and straighten my tube up. Do the same technique. Have him stay still. Shoot. Come back in. Lift up. Take this, stick it in the reader. And then now I'm going to go for the lateral. So if I can have a turn on that side. Making sure that the foot is down. You want to make sure that condyles are overlapping on top of each other, superimposed. Center right at the middle, in the middle of the knee. There's cover. Same maybe WD-60. If he's a bigger person, might bump up to the next level for the mass. Have them hold still. Shoot. I'm gonna take this, put the reader, and check. Make sure all the images are good. Then let the person go. Well, again, I'm gonna be doing doing 2 exams here. I'm gonna be doing the Leclerc and the Sunrise, or Setagast. So I'm gonna have my plate. I'm gonna have the patient lie on the bed like he is right now. For the Leclerc, I'm gonna go ahead and have him bend the knee like this. I'm gonna have a pillow underneath. I'm going to put the plate underneath, and then now I'm going to go ahead and get this angle to the right. Now, at this point, I've got the tube kind of angled in the same perpendicular to the tip fin, to the leg. I'm going to go ahead and make sure it's below below the apex of the knee, or the patella. Alright, now that's said, I'm going to do this at 60 at 4, roughly, depending on the size of the patient. And hold still, back, shoot, and then with already put this. And check to make sure I got it. And then at this point, since he's kind of got his leg already bent, I'm going to do Sunrise. So I'm going to have him, since he can do this, sitting up. Make sure my marker's on there. I'm gonna have to do this now. With the Setagast, I'm gonna have the leg bent, the angle bent, whatever is feasible. And then when angled, since it's a chanted tail, I'm gonna make sure that the CR is going right in between the patellofemoral joint. At this point, I'm going to go and do it's a pretty simple 60 at like about 3 or 2, and then hold still or look away before I shoot, and then shoot, and then I come back in, grab it, and relax, run in the reader. And then for the knee, you want to look at the space in between the femur and tibia. You want to make sure that look to see that the condyles are and epicondyles are perpendicular to their to the plate or image would be making sure that you got everything in there. That the joints, you want to have the joint space open to be able to see, for it to be a good X-ray. For lateral, you want to have the superimposition of the condyles, and that you just seeing the lateral border of the patella, and have a little bit of superimposition of the head of the fibula on the backside of the tibia. And then for the oblique, you're going to want to make sure that for the medial oblique, you want to make sure that the patella is kind of more towards the midline, medial side of the femur, basically, in other words, it needs to be over the medial condyle. Again, you still want to have the joint space open. You won't have as much of superimposition of the tibial or the fibular head. For the tunnel, you basically need to have the be able to see through the intercondylar space. Joint space is open, no rotation. For the Setagast, since we're looking in between the patellofemoral space, that needs to be opened in there, and that with this being here, that's the primary focus. So just want to make sure that this space is open. This would want to be more up, straight up and down, but for the most part, this is what you're looking for in the Setagast. Joint space open, no artifacts or anything. So, all right. Once I've completed the exam, I then go here and I down in here it says complete exam. I hit that, make sure it says complete, exit out. Then from there, I'm going to go in here, I'm going to log in, I'm going to find that same name, open it up, and hit, then go and go to the DICOM icon, and hit DICOM. Then from there, once it comes up, I know that it's been imported over, I'm going to view it, make sure that stuff it's all okay. I don't need for any cropping or anything like that. I make sure for my chest X-ray, I make sure there's an up arrow on both the PA and lateral, and then go in the notes, put in the text initials, my name, and then hit complete.